What were the deadliest diseases of the 20th century? A question that might spark curiosity in anyone with an interest in medical history, global health, or even human survival. Our journey begins with the influenza pandemic of 1918 to 1919. This was no ordinary flu, infamously known as the Spanish flu. It was caused by the H1N1 influenza virus. Astonishingly, it infected an estimated 1/3 of the world's population, leading to the deaths of 50 million to 100 million people worldwide. Next on our list is smallpox. This highly contagious and often fatal viral disease tormented humanity for centuries. Thanks to vaccination campaigns, we eradicated smallpox in 1980. But before that, it was responsible for millions of annual deaths. Let's move on to tuberculosis, or TB as it is often called. This bacterial infection primarily affects the lungs and was a significant cause of death in the 20th century. It remains a major health concern today, especially in developing countries. Then we have malaria. This disease is transmitted by mosquitoes infected with Plasmodium parasites. It caused millions of deaths, especially in tropical and subtropical regions. The HIV/AIDS pandemic emerged in the late 20th century, claiming the lives of millions of people worldwide. Today, while advancements in treatment have improved outcomes, HIV/AIDS remains a significant global health challenge. Cholera, a bacterial infection spread through contaminated water and food, caused numerous deadly outbreaks, primarily in areas with poor sanitation and hygiene. Typhoid fever, caused by the bacterium Salmonella typhi, was another major cause of mortality, particularly in areas with inadequate sanitation and limited access to clean water. Respiratory infections, including pneumonia and influenza, were leading causes of death, particularly among vulnerable populations such as children and the elderly. Diphtheria, a bacterial infection that affects the throat and airways, was a major cause of mortality before the widespread introduction of vaccines in the mid-20th century. Lastly, we have measles. This highly contagious viral disease caused significant morbidity and mortality before the development of effective vaccines. While vaccination efforts have reduced measles-related deaths, outbreaks still occur in under-vaccinated populations. These diseases had a profound impact on global health throughout the 20th century, shaping public health policies, medical research, and healthcare infrastructure development. Many of them continue to pose challenges to public health in the 21st century, highlighting the importance of ongoing efforts to prevent, treat, and control infectious diseases.